Hello everyone, I'm Jed Flowers, Director of Communications for Cabell County Schools, and today I'm joined with Elizabeth Atkins. She's the Public Health Educator with the Cabell-Huntington Health Department, Public Information Officer, and you do many other things too.
Sure, yes, many hats, like everybody else.
Yes, and she is, we're here today to talk a little bit about the flu occurrences that are happening in Cabell County and our surrounding region, and sort of to let you know what the situation here is in Cabell County and how that affects our schools. So first of all, Elizabeth, why don't you give us a little update of what is happening in Cabell County right now?
So right now in Cabell County we are definitely seeing a high increase of flu in our area. So we are seeing it with all ages, and of course our at-risk populations. We definitely want to make sure that they are taking those precautions because flu is widespread right now throughout Cabell County.
Yeah, so we are seeing some cases in different places, the hospitals,
yes,
medical centers, those sort of things.
It is out there.
It's out there, and, and of course we've seen some of that in the schools as well. And last week you guys offered some guidance that there was some widespread flu activity.
Right.
At that point we released kind of our attendance policy, and we said,
absolutely, that's
please,
how we track it.
Yes, and we also, we share information with you guys and let you know about
great about our partnership, right?
Right,
yeah.
And we count on you too as public health officials to let us know, when school closures are appropriate, when they're not.
Absolutely.
How we're doing as far as our attendance rates and those sort of things. So we've been sharing that information. We also relaxed our attendance policy as well.
I saw that, yes.
Yeah, and we did that to allow parents, if you have flu-like symptoms, or your child has flu-like symptoms, you can just keep them at home and it'll be an excused absence. And that's very, very important because it helps with keeping the spread of the disease down.
Absolutely.
Right?
That is one of the best ways you can protect yourself. If you have flu symptoms, it is best to stay home. Stay home to protect yourself, get better, but not to spread anything that you may have. So that's definitely a precaution that we recommend. Of course, number one is to get your flu shot. Is most important. You can still get it at the health department Monday through Friday. It is not too late.
Oh, okay.
We still recommend it. It's still beginning of February, so we are still in peak season of the flu right now. So it's still important to get your flu shot if you have it. Again, it's free at the health department Monday through Friday. So that's, number one. Number two, stay home if you're sick. Definitely don't want to be spreading any germs. Use proper, hand etiquette with your hand washing, but also the corner,
cover your cough,
yes,
right?
Is a good activity to do, and little kids even do it too.
Yeah. And we do that with the students. We actually have the elementary teachers doing that. Cover your cough.
Yeah.
And preferably if you have a tissue, you use a tissue.
Absolutely.
But if you don't have one, so you don't spread the disease, you just put it into your elbow.
Absolutely, yep.
If you have to cough or sneeze, and it's that easy, really.
Yeah.
And then make sure you wash your hands a lot.
Yes, lots of hand washing.
You guys recommend usually like singing happy birthday twice?
So we recommend singing happy birthday 2 times, yeah. So we are getting ready to do a huge campaign around that. So we are excited. We're going to get a lot of officials in the community to sing happy birthday for us and to help spread the word, because it's a simple thing you can do. You can teach young kids to do it. So, when you are there washing your hands, just sing happy birthday. If you want to sing aloud, go ahead. If not, just sing it in your head.
Okay. And where we are with schools right now, we have a lot of questions come in because, there's some school districts around us that have canceled school because they have a lot of flu cases.
Sure.
Right now in Cabell County, we've been sharing this information with them. We're about 90% attendance at all of our schools, which is actually pretty average for this time of the year. We generally have illness in this time of the year, so we haven't seen it impact our schools greatly yet.
Right.
And that's why we do want to take precautions. Make sure that if you are sick, stay home.
Absolutely.
And do the hand washing and do all that sort of thing. So at this point, it wouldn't be recommended by the health department to close schools.
It is not recommended, no. The health department follows state guidance through the West Virginia Office of Epidemiology and Prevention Services, and they do not recommend school closures unless there is just simply a lot of teachers are out and they are sick. Obviously, we need to have instructors to do so, but that would be our only reason.
Just when we get to a functional state.
To a functional state, yeah. But when you have an absenteeism rate that's still 90%, still pretty good. So we're not gonna visit that right now.
And there are a lot of other considerations too about kids being in school. Their parents work, or we also feed kids.
Right.
We have universal free meals, so there's a lot of reasons for children to be in school if they're well.
Absolutely.
And then of course if they're not well, what would you do with the child? If they have the flu-like symptoms, what would you recommend a parent do?
It's very simple. Keep them home, monitor their symptoms, of course, take them to the doctor to get tested for the flu. There's medication the doctor can prescribe, but just good hand hygiene, cleaning surfaces is so important.
Yes.
The flu can live on a surface for 2 to 8 hours. In some cases. So it's important to be cleaning, every day, even after school is out and so forth. So it's just really important.
Yeah, our schools are doing the same thing. Our custodians have been doing extra cleaning. We've given them the guidance to do that.
Absolutely.
To help kill some of that surface stuff and control the spread.
Right. And one thing too for parents to know is, if they're participating in sports or other activities, limit those if they're sick. Even if they start to feel better, give it a couple more days before they're out in public again, which is so important.
Yeah, we want everybody happy and healthy and
they can still
learning.
shed the virus even on medicine, so it's important to just keep those precautions in mind.
Well, Elizabeth, thank you very much for joining us for our flu update today and helping keep all of our parents and our community informed about what is going on with our school system. We're trying to monitor the situation daily. We are tracking attendance daily, sharing that information with the health department officials, and we'll continue communicating with them, and hopefully this flu season will pass soon.
Absolutely. I'm ready for spring.
And thank you for joining us.
Thank you for having us.